Hello.
Hi, Hannah. How you doing?
I'm okay. How are you doing?
I'm good. Hi, everyone. Thanks for joining. We were just talking before we went live, and I always wish we could have a behind the stage or the backstage version of.
I never know how much backstage to bring into the live. How real do we want to get?
Not real. We should get really real, but maybe, when keeping it real goes wrong is a real thing. So,
But tonight we are here to talk about women's health and fitness.
mhm.
But also, we have a special thing to announce, a treat, if you will,
Yeah.
an opportunity for the community. But we'll save that.
Well, we can go ahead and give the announcement, now. I don't want to leave the
All right.
wonderful listeners waiting. Um, so, we talk often on this broadcast about being honest and telling your truth and being comfortable with your truth. And so we want to encourage women to do that in all aspects of their life, but especially their gynecological and sexual health. And so, as you know, we've talked often a lot about the intimate aesthetic services that we offer. And so we want to encourage women and entice them to tell their truth with a free giveaway. So the name of our giveaway is Tell Your Truth and Live Your Best Life. So to normalize the need for sexual wellness services and be more open with how common the conditions of vaginal dryness are, decreased sexual satisfaction, pain with sex, incontinence, and all these things that we've talked about, it's necessary that we all talk about our experiences. And that starts here with me. To win a free intimate aesthetics or sexual wellness service of your choice, give us a like, tag a friend. Each comment that you tag is a separate entry, and comment on which service you're interested in. Tell your truth. Let's talk about our problems. The way we normalize it is by talking about it.
Yeah. So best case scenario, you get to have a treatment of your choosing,
Mhm.
and worst case scenario, or otherwise, I guess if you don't win the giveaway, you still win because you have started discussing these things and
Yes.
maybe realized that there was something going on, that there could actually be, you could live a better life.
Yeah.
I
Yeah.
think if you don't talk about these things, if I weren't here talking to you about these things, I wouldn't have realized half the things that I perceive as normal are things that could be better.
Yeah. I think just to your point, even if you don't win, you still win because that information's gotten out there and it's probably helped someone else, and so we're just moving it forward and paying it forward. So the services are those things that we've talked about here, the O shot, one of the Vitalia services, or temperature firm service, even BioT, the hormone replacement service. Obviously, there's a discussion and we talk about what those services entail, but you can pick whichever one you want. And it's not only for those persons that are in this immediate area. We're opening this up to the audience at large, wherever you are. If you can make it down here, we'll give it to you for free. Just, tag and like us and comment.
So if you are watching this on YouTube, the good news is that there have been prior YouTube conversations where we've discussed each one of those treatments in depth. So if anything sounds interesting, you want to know more, go back on our channel and find the topic. So if you want to learn about BioT, go check that out. If you are wanting to enter the giveaway, however, then you're going to hop over to our Facebook or Instagram, and there'll be a post that comes out tomorrow. If you're with us right now on Facebook, it will come out Thursday with the details of this giveaway so that you can comment and like on that post. And we will announce the winner for that in 1 month.
Yes, and we're doing this monthly. So you have chances upon chances upon chances each month, a new chance.
And don't be scaring away other people because you want to make your chances better, because it's going to happen. I think that is so cool. I love that you're doing that. And I really, recently was in, at Devotion and had a provider ask me about my sexual wellness, and I said, it's good. And she said, really? Good. Up in octaves. And it's just one of those things that sometimes for some people, and I put myself in that category, it just takes some loosening up to get rid of the cultural norm of not discussing these things.
Yeah. Yeah. And that's okay. And so when you get past that, that's when the work can really begin.
Mm-hmm.
So let's get past that point. I'm so excited to talk today about women's health. We focus on a lot of things on this broadcast, and women's overall health is one thing that we haven't delved in a lot, but I'm excited that we're doing it today. And we're going to narrow that focus down to 3 widely common conditions: high blood pressure, diabetes, and thyroid disorder, and just briefly talk about how they impact women. So high blood pressure is a condition that makes your heart work harder, and over time can cause scarring to your arteries, your blood vessels, and cause your heart to start to decompensate. And it's widely misunderstood. It's oftentimes called the silent killer because it over time does do that. And so there are many women who suffer from high blood pressure, normal blood pressure, being now defined as less than 120 over 80. And so you have categories above that, mild hypertension and severe hypertension. And it's something that is very readily treatable. It's something that's extremely common. And so it can be treated by just improvement of your activity level and improvement of your diet. Something as simple as that, decreasing your salt intake. If you've been listening to the news lately, the FDA is considering decreasing the salt content or requiring salt content in snacks. And our daily salt intake really should be about a teaspoon. Definitely, most of us get more than that, but that salt intake does impact our blood pressure, and that's salt in everything, not just your food, but also what you drink. Also has sodium. And so improving your diet and decreasing your salt intake and increasing your exercise definitely can have a wonderful impact on your blood pressure. But there are also medications that can be used too. And so the most important thing with the medication is being consistent with your medication, so you can consistently have a blood pressure that is not harming your body. Oftentimes I have patients that decide, well, my blood pressure is good today, so I didn't take my blood pressure medication. You should continue. If you have a normal blood pressure medication while you're taking, or normal blood pressure while you're taking blood pressure medication, that means you actually need it. It doesn't mean to stop. So having a continuously normal blood pressure is a positive thing, as opposed to having periods where you're cycling, where it's high because you're not medicating as you need to be.
Can I stop and ask one question that is very silly, but because it's so silly, I never ask it. And I don't know, maybe I'm not the only one. I just cannot for the life of me understand those numbers. Mm-hmm. Can you just...
Oh, good question.
Dirty what the numbers are, because people were, I get it reported and I'm like, great, you might as well have said it to me and in Greek. I don't understand.
Yeah. So you have your top number and your bottom number. And so the top number is called the systolic. And so that's the number that I said that normal is considered to be less than 120. And the bottom number is your diastolic. Mm-hmm. And so that's the number when that's the number I refer to, less than 80. And so the systolic is measured when the pressure in the arteries when the heart actually beats. The diastolic is the pressure between beats.
Okay.
So again, there's different levels of hypertension, and definitely it is possible to have a normal blood pressure. It is possible to, even if your family has a high blood pressure, high blood pressure runs in your family, it is normal to still address that, whether you're doing it with medication or by a change in lifestyle. And in menopause, we talk about cardiovascular risk going up in menopause. And so having hypertension as a premenopausal woman or a perimenopausal woman definitely will impact your cardiovascular risk when you become menopausal, and can increase your cardiovascular risk. And so it is really important to maintain. There are certain stages in our life where we automatically can have risk for elevated blood pressure. One being during pregnancy, another during menopause. And so trying to keep it as normal as possible is really important, because again, it is a silent killer.
Mm-hmm. And so if you go through some big change in your life and you think that you might be ready to change that medication, that's something you would then revisit with your doctor before you.
Yeah, and I think great point. It's really important to stay engaged with your healthcare provider that's prescribing your medication. If you feel like you don't need it, don't not take it. Make an appointment and have that discussion, because there is a possibility that you just need your dose lowered. If you are taking medication, you consistently have elevated readings at home, or you consistently have symptoms of high blood pressure, you're always having headaches, talk to your provider. You may need something added on to it. There's no reason to suffer in silence or to continue to have that problem in silence. There's all the reason to have that discussion.
Mm-hmm. Yeah, that's a good point too, about that we're changing all the time, and that just because you have some diagnosis or go on some medication doesn't mean that that's the way it stays forever and ever. We have agency in this.
Yeah. So we also talk about diabetes, and diabetes in women is very different than diabetes in men. Women with diabetes have a higher risk of heart disease than men with diabetes. Diabetes in women definitely is affected directly by, weight. Diabetes in women can increase the risks of infections. I see oftentimes women with recurrent UTIs or recurrent yeast infections, and the first thing that I assess them for is diabetes. I can't tell you the number of times I've diagnosed diabetes just based off of that occurrence. And so, again, another thing that is manageable and that can be managed with medication or without medication, with change of lifestyle and also diet. Having uncontrolled diabetes can affect your menstrual cycle. Having uncontrolled diabetes and PCO, or diabetes and PCOS, are related to one another, And so, again, for those women who are at the stage in their life where they are wanting to become pregnant, an elevated blood sugar can impact your ability to become pregnant. And so keeping that under control, keeping that in consideration is really important. Diabetes impacts our ability to orgasm. Diabetes does, uncontrolled diabetes will damage blood vessels, right? And so you have to think about it. What does the clitoris need, or what does the clitoris have? A lot of blood vessels. You have a lot of blood flow there during intercourse and for sensation. You have a lot of nerve endings there that need to be bathed in blood. And so uncontrolled diabetes is going to go to those small vessels first and damage those first before the larger vessels. And so that can impact your sensation. So, we don't think about the relation, but it's there, right? Our overall health does impact our gynecological health and our sexual health.
I didn't know half of the things you just said before. I'm so surprised. I did not know that there was a difference in women from men. I did not think that you would necessarily be in the person catching these things, but it makes sense to me and speaks to women in their and like specifically women's health. And I love that you're bringing up the relation, how it all impacts each other.
Yeah. Thyroid disease also, that hypothyroid disorder, we oftentimes consider thyroid disorder in the form of hypo with weight gain or inability to lose weight. Definitely, yes, there is an impact there, because the thyroid hormone it controls many activities in your body. It is a metabolizer, right? It helps in metabolism. But thyroid disorder can also affect your periods. Hypothyroidism, you can stop having periods because you're not ovulating because your thyroid it has some dysfunction. And so, again, something to remember, something to consider. If you're always tired, you're always dragging, your skin is changing, your periods are kind of becoming weird, yeah, that could be related to your age, that could be related to stress, that could be related to menopause, but also could be related to thyroid. In pregnancy, it's important to know your numbers, and important to know what the function is after pregnancy also. You know, if you are having trouble lactating, thyroid can impact that. And so just things that we all as women should just be aware of.
So maybe this is tangential, so stop me if I'm steering us off course. But for women who are, for some reason, but using a birth control that then stops periods, would that be a way, does that sometimes mask people from uncovering these other things because you don't know if you have an irregular period because you're not getting one because of, a birth control or something like that would stop your cycle? In a way, you're losing that stream of communication with your body.
Well, I would say this, there usually are more symptoms when you're having a disorder that's really uncontrolled than just absence of menses.
Okay.
And so even though absence of menses can be a symptom of a disorder, it's not the only one. So I wouldn't necessarily use that only as evidence of having the disorder. But I get what you're saying, and yeah, but that's why you go and have your visits with your doctor, and then talk about all of those symptoms that you're having, or all everything that's happening to you. And one of the things that we wanted to address, or I wanted to address specifically, is all of these conditions are not isolated to just one body type. All these conditions aren't isolated to women with elevated BMIs, or more habitus, or more obese than others. You can be within a normal BMI and still have all of these conditions. Actually, I had a patient like that today, completely normal BMI. So we don't need to only focus on the outside appearance, even though I talked about, weight management and diet, nutrition, which is very, very important. I don't want to discount it at all. We don't need to only focus on our outside. We need to focus on how we're doing on the inside. How healthy is our heart? How good are our numbers as far as our blood sugar goes, and our, specifically for the three that we're talking about, our thyroid levels, what they are. But it's not just the outside. It's not just what we look like. It's also how we feel and what's going on inside.
It's such a good reminder. It's so important. I don't even, I recently went to my primary, and he kind of did the full workup, and I was like, why is he doing the full workup? I think I'm fine.
Yeah.
No?
Well, what? I will tell my age. I'm going to be 40 this year. And so it's important to have a primary care doctor. You definitely don't need to only see a physician at your annual visit for your pap smear. Even though you may appear healthy, right? Because you're within whatever is considered normal BMI. You got to make sure that your organs are functioning well. And so to go for your yearly annual exam with your primary care doctor, to get your cholesterol checked regularly, to get your hemoglobin A1C and your sugar checked regularly, your blood glucose, to get your thyroid levels checked regularly is important. Because you need to know how your organs are functioning.
Yeah, I mean, we had International Day of the Girl, where we had our daughters join us last week, and we would absolutely not think twice about making sure they went in for their visits. Yeah. So we should do the same for ourselves as we would do for our loved ones.
Yeah. And again, this is not age, this is not body type specific. And I will also say this, even though there are age ranges where these conditions are more common, it is not age specific. You know, I'm seeing younger and younger women with uncontrolled hypertension, unfortunately, right? And so it's important that we stay engaged in our own health throughout our years.
Well, thank you for that. And thanks for being with us, you guys. If you have any questions about what was discussed tonight, feel free to send us a private message. Or if you have an idea or a thought that you want us to cover, please be sure to send that to us, either as a comment or as a direct message, or check the back episodes. And don't forget to enter the giveaway for this month to see if you can get yourself a free treatment.
You know what? If you'd like to see Hannah and Mary backstage, comment on that too. Let us know.
We start a little early. I won't tell her when we go live.
Yeah.
Good night, everybody.
Good night.